Welcome to Flip Your Script, the vodcast from the American College of Lifestyle Medicine that's all about clinicians redefining care through lifestyle medicine. My name is Dr. Padmaja Patel. I currently serve as president of the American College of Lifestyle Medicine. I'm board certified in both internal medicine and lifestyle medicine. I also serve as a chief medical officer at Nudge Health. In just about 15 minutes, we will bring you 5 key takeaways from leading experts and practitioners who are using evidence-based lifestyle medicine to transform patient outcomes. From practical strategies to success stories, we focus on the how of lifestyle medicine to empower you to make an impact in your practice and beyond. In this episode, we are honored to be joined by Dr. Elizabeth Markle and Jacque Salmon. Dr. Markle is a licensed psychologist, speaker, writer, researcher, and professor of community mental health at the California Institute of Integral Studies. She's the co-founder and executive director of Open Source Wellness, a national nonprofit offering experiential behavioral health and wellness via a community as medicine approach in collaboration with healthcare providers, payers, and community-based organizations. Jacque Salmon is a trauma-informed health and wellness coach specializing in lifestyle medicine with a focus on whole plant nutrition and stress management. As founder and executive director of Seeds to Inspire Foundation and founder and CEO of Angel in the Stone, Jacque bridges clinical care with grassroots solutions to address chronic disease and nutrition insecurity. Jacque reversed type 2 diabetes, hypertension, and GERD, losing 164 pounds through a whole plant-based lifestyle, and now helps others to do the same. Welcome, Liz and Jacque. How are you doing today?
Thank you. So happy to be here today.
My pleasure. I'm glad you could join us today. So you both play a unique role in delivering lifestyle medicine through community-based organizations. Please tell us briefly about your work and what motivated you to create these nonprofits. You can start, Beth, and maybe Jacque will follow.
Okay, sure. So I lead an organization called Open Source Wellness that was founded in 2016 based out of my and my co-founders' experience working in the federally qualified health centers. And based on that experience, we built and we now deliver and are spreading and scaling a model that we call community as medicine. And community as medicine, we understand it to be an experiential, equity-centered, trauma-informed, and joyful approach to group health and wellness coaching. And part of our commitment is to translate lifestyle medicine practices and provider recommendations into an effective model supporting people with our universal prescription. And we like to abbreviate it Move, Nourish, Connect, and Be. So those 4 icons in our logo there represent that: physical activity, healthy nutrition, social connection, and stress reduction. And part of our commitment is that we are not telling people what to do. We're not giving advice. We are actually doing these practices in community in a way that makes it socially rewarding, joyful, and sustainable. So again, this was born out of the work in the federally qualified health centers. We learned how to deliver this as group medical visits for financial sustainability, and we're now really focused on spreading and scaling the model via partnerships with YMCAs, clinical delivery systems, and other community-based orgs. So I'll pause there and hand it over to you, Jacque.
Powerful.
Thank you so much. So our organization really was born of my personal experiences, as you shared. I am a mom that went through some stuff and realized that the stress in my life and the trauma that I was experiencing, not just in childhood, but the ancestral trauma, had all culminated in my body and created the prime conditions for chronic diseases to manifest. And what was alarming was that it was manifesting in my children. And as teenagers, they were diagnosed with high cholesterol, with prediabetes, obesity, depression, anxiety, and we were just all on a plethora of medicine. And it was addressing the helplessness that I felt as a human being, as a mother, to pass on these patterns to my children without any solutions. And so I started on this journey to figure out how to get off the medicines. And the autodidactic researcher that I am kind of led me down a path that helped me to understand that if I didn't deal with the stress that was in my life, there was no way I was going to have the energy or the focus to make these changes that I needed with the way I ate, how often I slept. And it was that journey of bridging these two, that stress in my life, the trauma that in my life, with wanting to make better choices, wanting to model better choices, but not having the capacity to do so. And that led me to reverse all of my chronic diseases after I discovered whole plant-based nutrition, yoga, meditation, journaling, self-love. All of that led me to a pathway that I said, I need to be able to share this with my family, with my neighbors, in my community. And that's how Seeds to Inspire was born. 2 years after it was born, I discovered that there was actually a framework out there. There were actually clinicians out there that had figured this out and were doing that. And that is where lifestyle medicine merged into our work.
Powerful. Wow. Both of you, what an inspiring stories, and really creating a community experiential pathway for patients and everyone else. And then Jacque, your story. Wow. Not only that you reversed, but you now bring your authentic self and in inspiring others. So thank you for sharing that. Liz, you recently co-authored a paper on equitable access to lifestyle medicine that is published in the American Journal of Lifestyle Medicine. And you voiced concern that without intentional and collaborative input from stakeholders and members of the communities we serve, lifestyle medicine is at risk of evolving in ways that are inapplicable and even alienating to diverse and underserved populations. Tell us more about this concern and how to address it.
Yeah, thank you for the question. So I want to acknowledge that we're living in an extraordinary moment for lifestyle medicine. I mean, every day in the Journal of Lifestyle Medicine and others, we have new breakthrough research coming out about the root causes of chronic illness, about gut health, about mental health, about the microbiome. It's incredible. Our understanding is exploding. But the question that we then need to ask is, now what? How does all this insight translate into actual change in clinical practice, in patient experience, and in health outcomes? And maybe more importantly, the question is, for whom do we translate this insight? And so, right now, if you have financial and sociocultural privilege, you can access incredible levels of boutique care, right? There's precision medicine, there's private testing for anything and everything. There's high-touch health coaching. There are wellness retreats in gorgeous tropical areas of the world. And I'm not knocking any of that, but what about for everyone else?
Yes.
And this is where the FQHCs come in, or the federally qualified health centers, because these are these incredible local institutions that are serving those that face the steepest structural barriers to care. And so I think we have to learn from what's happening in these clinical care contexts. I encourage anyone to train in an FQ, to work in an FQ, to shadow in an FQ, because you won't see healthcare the same after you have done that. So, I think there are two places where we are at risk. One is that, and I know I'm preaching to the choir here, but it's not enough to simply tell people what to do. It's not enough to say, you need to exercise more, you need to eat better, you need to reduce your stress, and then say, good luck with that. Off you go, see you in 6 months, take care now. I mean, that is what my co-founder and I saw replicated in clinical care, and it's not the provider's fault. They're doing the best they can in an impossible system, but it's still, it's a behavioral prescription with no pharmacy to deliver it, right?
Yeah.
And there's such an equity problem with that. So I think that is one place where we can't say, like, I gave the advice, that was my lifestyle medicine intervention, like, we're good here. So that's one. And then the second one I want to name is that we are at risk for training solo lifestyle medicine clinicians and and sort of setting them loose in their clinics with the expectation that they're going to transform the system. And that is a recipe for heroic effort followed by burnout, right? We see it over and over again. And we have these extraordinary lifestyle medicine clinicians who are, they are the vegan chef, they're the meditation teacher, they are the Zumba teacher, right? Like they are the health coaches. Jackie, you are sort of the example of this, but we cannot hinge our system transformation on those individuals. We really, really need it's a team sport, and we need an ecosystem approach that includes community health workers, and we use health and wellness coaches. But I think without that systems approach, and community as medicine is just one example, we are at risk for kind of missing the boat on making this a rising tide that supports everyone.
Well, thank you. I really appreciate those insights, and I want to just respond to some of those comments because yes, I actually resonate with your challenges and your concerns because I had the same question as I learned about lifestyle medicine early in my career. Yes, there's plenty of science and evidence and it works. What next? What do I do with it? And so I've been on that journey to really understand those systemic barriers. How do we integrate that into clinical practice? How do we advocate for better payment models, which includes entire interdisciplinary team members? And how do we create rewards for better health outcomes? And how do we, champion better quality measures? Because that's been another way where our clinicians have been penalized. So I put a lot of time and energy, and I could tell you for sure there's a lot of moving, there's a lot of momentum building around that, which is very exciting. In terms of team, and I think you know that we have clinicians who are getting trained in ACLM board certification, but we also offer training for entire healthcare workforce. So we're not just training doctors, we're training health professionals, we're training dietitians, we're training health coaches, we're training the entire community health workers, every one of them, because yes, as you say, it's a team sport. So clinicians alone cannot necessarily deliver. Just like, as I always say, lifestyle medicine is not just what happens within a clinic setting. There needs to be a community element. So same way, it's a team sport. And from ACLM's point of view, we are training the entire healthcare workforce. So thank you for those comments. I know both of you are making lifestyle medicine available to underserved populations through unique community-based programs that include teaching kitchens, group health coaching, and more. What is the unique role of community in the services that you provide? Jackie, would you like to add to that question?
Yes. First, I want to say, Liz, thank you so much. I so appreciate that approach, and it really does help kind of put a backdrop to what I'm going to share about community. I feel what's unique about the work that we do is that I see myself and our organization as colleagues with community leaders that are already focused on healing. There is already a health and wellness network existing within the community. There is already leaders that completely dedicate all of their energy, all of their passion, all of their time to working on healing, but they're approaching from different perspectives. And the majority of the leaders are focused on social determinants of health. They're focused on safety. They're focused on dire stress situations.
Yeah.
So when we partner and we see them as colleagues, all focused on the same community members, and we bridge our resources and our tools together, now we synthesize that into a really powerful message and a really powerful effort into healing holistically. And we start with community leaders because we see the same patterns we do with our clinicians and our medical students that come out raw, ready to go. And the burnout is imminent and we see it. I'm in my 50s. I see the burnout. I've been there. So we go to community leaders to make sure that they can keep going, but also to understand that they are trusted. People come to them, they know they're trusted. So if we can partner with them and they can take this on, and the community can see the healing that happens within them. Let them speak for themselves, and then we can continue to move on. And we do our approach two ways. We come a team approach, we come coaches, we have plant-based chefs, we have our medical director. So we come with a team approach, and we do healing gardens, food as medicine, teaching kitchen, group coaching, all within the garden and in the teaching kitchen. And we meet people right where they are, whatever situation, whatever institution, organization, and we customize our programming to meet the needs so that we can incorporate what you're doing. We can incorporate lifestyle medicine in. And because my lifestyle medicine just meets everyone where they are, what better way to just support them and amplify their work and spread their healing even more?
Powerful. Thank you. Elizabeth, would you like to add anything about the unique role of community in the services you provide?
Well, first I want to say, Jackie, I want to come to your program. I think my whole team needs your program, so I'll be reaching out. I would say that, for years, community or social support has sometimes been considered like the side effect or the side dish. And what I want to suggest is what we're learning is that it's really the active ingredient, and that there's a difference between informational interventions and transformational interventions. And part of what I love that you're describing, Jackie, is something transformational. And so, I've been doing this for 9 years now. In the past 3 or 4, I've been thinking a lot about what is it that makes community as medicine or any transformational intervention really powerful. And I've come to think that there are 3 big components. One is like you need vitality, right? You need joy, you need play, you need self-expression, you need people to feel free to express themselves. You need vulnerability, right? You need safe and appropriate ways for people to say the hard thing, to tell the truth about what's going on inside themselves. And then you need action, right? You need ways to translate insight into writing prescriptions for themselves. Okay, here's what I'm going to do tomorrow. Here's what I'm going to do this week. And so, I think if we can find ways to incorporate these active ingredients, what we know from both the quantitative outcomes and the qualitative outcomes is that the relationships drive engagement, they drive retention, they drive success, right? People say, it was my coach. She saw me, she heard me, she got me. It was my small group. They had my back. That's what people say helps them make transformational change.
Absolutely. Absolutely. I know you both have talked about the importance of scalable, flexible partnerships with clinics and other community organizations. How can these partnerships extend the reach of lifestyle medicine to underserved communities?
I'll start. So the way our work has shown, the proof of concept is that when we work together with the organizations, with the community, with the family, that ripple effect happens naturally. I'm, again, a patient that became a coach because I went through this myself. Yes. I saw the effect of the people around me. I saw that I didn't have to argue. I didn't have to fight. I didn't have to defend. I just had to focus on me and doing what was best for me. And how I learned to trust my instincts and trust my intuition was to deal with that stress, was to deal with all the traumas. So when we partner with organizations to do as you so beautifully share it, Liz, about that authentic voice, about that safety, is to empower the individual, the group, to remember that they have the tools within them. And I, as a coach, will support you just like we would in the gym. It's an underdeveloped muscle. I know it's there. I have it. I've used it. I built it up. How can I help you do that? And when you empower people individually, you can't help but radiate that healing, and you can't help but to provide opportunities for people to say, what are you eating? What's different about you? You seem peaceful. You seem calm. Tell me more. We've seen it happen in the community, and that's why we're focused on the healing, because we bring the nature therapy, right? That forest medicine, that we understand the science is very clear that when we connect with nature, we can connect with our stress, where we can stabilize our central nervous system, then we can sit with those patterns and question ourselves. When we can model that for other people, it's contagious. And people want to learn more, they want to participate more. And so we just there to provide that opportunities to spread, because we know it's going to happen.
Couldn't agree more. Yes.
So beautiful and so alive. I'll take this question sort of to the systems level. I think there are two pathways to sort of spread and scale of impact that I'm looking at. And one is one that ACLM has been talking about so beautifully for years, which is group medical visits and shared medical appointments. And the slight tweak that we offer is, let's not make it the provider's responsibility necessarily to run the whole show, but by partnering with community as medicine programs, you have a team of coaches who specialize in leading movement, leading mindfulness, doing that small group coaching, culture weaving, liberating the provider to focus on some of the top of scope things. There are incredible financial sustainability pathways available there when we embrace clinic community partnership. And then the second one I'll name is that, even the most resourced and progressive thinking clinical orgs have limits, and they have capacity issues with what they can accomplish. And this is where partnership with organizations like the YMCAs are so profoundly the pathway here. So there's something like 80% of the US population lives within 5 miles of a YMCA. And YMCAs are going through their own whole rebrand where they're no longer just a swim and gym. They are becoming the trusted partners to the healthcare delivery system. I had one YMCA exec say, what if we were the extension of the primary care office? And
wow.
Right. So for providers to be able to say, okay, you do need more physical activity, you need different nutrition, you need stress reduction, you need social connection. I'm going to write you a prescription for community as medicine as an example, and it's delivered physically at the YMCA, and your insurance is going to cover your 12-week prescription, after which you're going to have relationships there. You're going to be comfortable in the space. We hopefully have a pathway to lifelong membership and access to all the resources there. That's an example of one of the ways that we at Open Source Wellness are pursuing impact at scale, not by becoming a giant nonprofit, but by leveraging culturally relevant local relationships and anchor institutions, really. So that's part of the pathway forward, what we're so excited about.
Very well said. Thank you.
I forgot to mention, may I add something? I'm sorry,
yes,
I forgot.
please.
Totally.
Yes.
That model of scaling is building our healing gardens and our food as medicine program within the organization, the institutions, the homes of community members. And so we're documenting those processes by making it achievable for everyone to start growing food wherever you are. And when we start that way and we just bring it down to the basics, this is about normalizing eating at home. So everyone can relate to that. Everyone's pocketbook can relate to that, but also the access to the medicine, to create that opportunity to be your own alchemist in your own kitchen, to grow the food and then bring it to your home, but also have a community area where we can all gather together and share that. So spreading those healing gardens, and then we can move away. And those, we know that those are going to sprout and be self-sustaining, and each organization will be an anchor, lifestyle medicine hub, so to speak, for that population. And we know that then they will internetwork and support each other, and we can continue to move on and build. And we can see that kind of like a neural network of how this will spread. But more impactfully, I feel, again, it's addressing kind of like the back to basics, that culture, and fusing when you bring in joy, music, expression, and you merge that into that again is something that spreads and is appealing. And this year we have the privilege of working with clinicians and medical students to work and bring them into the community as volunteers and as learning how to bridge this into their practices moving forward. So this year is going to be very, very exciting for us.
Well, great. Thank you. In closing, what is your top advice to ACLM members who want to make lifestyle medicine more accessible to underserved and underrepresented populations? And I would like both of yours insight on this question. Go ahead, Jay.
Oh, go ahead.
You know, everything inside of me is saying that we have everything we need. I think it begins with the clinician and the practitioner to believe that they can do this and to understand that the community is already doing this. They're ready, they're doing this, we're healing, we're working on these aspects, and we welcome the tools and the resources you have if we can meet together. And if now is not the time when, we encourage everyone that believes in lifestyle medicine, sees it, and also sees this intersection to pour themselves in and to understand that we are ripe and we are ready, and we need to stop relying so heavily on the systems and support each other in the grassroots, go back to basics, and understand that your commitment is valued as colleagues and friends within the community.
Awesome.
Thank you. Well, my first recommendation would be, as I said, get to know your local federally qualified health center. Train, work there, volunteer there, shadow there, get a sense for what medicine looks like in that context. And if you're building an app or a tech platform that is going to transform lifestyle medicine, pilot it with an FQHC and get real life feedback on how this is impacting the populations that you seek to make a difference with. And then the second thing I would say is that if you want to leverage community, human connection, social support, you need to design for it, right? Just like we have architecture and we have urban design, we put a lot of attention on how we create physical spaces. We can bring that same level of attention to how we design social spaces and social interactions that actually generate vitality, vulnerability, action, and human well-being.
Well said.
Can I add something? I'm sorry, because you always inspire me. I'm like, oh, it took somewhere else. If I may add, is how we started was going to the community, caring about what they care about, and seeing how I could support them and furthering their health and their mission, so helping them see their blind spots and how lifestyle medicine can support their work. And I think when we can bring our hearts together in that way, our minds together, say, they care, I care, how can I just be present for them at this moment, learn them, and then understand how I can create a pathway to what I'm passionate about and what I know can support, and merge with that. So I think if we come with humility and commitment to being present in the healing moment and letting the community, allowing the community to communicate with us their needs and their hows, and then bringing our resources in that way and celebrating in community, I think that that's also a pathway forward, is to show up, volunteer, learn, be curious.
Yes, wow. What a powerful and inspiring message you both have offered today. It's been an absolute pleasure speaking with you too. While we're out of time, I want to thank you for your valuable insights and for so generously sharing your knowledge and expertise. Thank you to our audience for tuning into this episode of Flip Your Script. We hope today's conversation has inspired you with practical insights on how lifestyle medicine is shaping the future of patient care. If you enjoyed this episode, don't forget to like, subscribe, and leave a comment. Stay connected with us for more episodes featuring clinicians who are rewriting the script on health, one patient at a time. Until next time, take action, make an impact, and keep flipping the script on healthcare. Thank you.